get additional information on lupus, and I'm in the Southern California area for our National Kidney Foundation team. And this morning, early afternoon, it is my pleasure and honor, quite frankly, to introduce these two wonderful ladies, Juana Mata, Estela Mata. And Juana is a lupus, was diagnosed with lupus about 15 or so years back, and has a wonderful story that she will share with us, and became an advocate and started and continues to be president and co-founder of the Lupus for the Looms for Lupus organization that she put together along with her sister Estela. And around the time of her diagnosis, Juan experienced some pain, aches, and fatigue, as most people do. And I understand some minor depression. And it is then when she began to, as a therapy, begin to knit. And that's how her road to Looms for Lupus journey began. And so I would now pass it on to her to tell us a little bit more about her story and her sister's story with her condition, her current health status, and more importantly, all the wonderful work that she's done through her organization. So ladies, please take it away.
Hello, everyone. Thank you so much for inviting us. We are happy to be here. I am Juana Mata. I am one of the co-founders of Looms for Lupus. And yes, I was diagnosed with lupus in 2009. I was diagnosed in 2009. And before I was diagnosed, I started having symptoms, I want to say about 10 years before, but the symptoms really started getting really bad a year before my diagnosis in 2008. In 2008, I started having body aches that were so intense that it was very hard for me to move or to even get up in the morning to brush my hair. I was diagnosed initially with rheumatoid arthritis, and soon after being diagnosed with rheumatoid arthritis, I continued to have the intense pains, the fatigue, the headaches, butterfly rash. I was losing weight. My hair was falling. And with that, I also started having mouth sores and nose sores, and rashes all over my body, rashes under actually on my scalp, on my body, my soles, my feet, my next to my nails. And I knew that, something was more than just rheumatoid arthritis. I knew the symptoms for rheumatoid arthritis, and I knew that there was more than that. Anyhow, in April, I had a really bad rash on my face, and I decided to, again, continue to go to the doctor. Nothing was given to me. And in May of 2009, the mouth sores continued to get really bad to the point that the sores in my mouth looked like open wounds. So in May of 2009, I went to the hospital or to urgent care. I spoke with the urgent care doctor, which, I was concerned with my health. I told him I was concerned with my health. I told him that I felt that there was something wrong with me. He said, "You look fine. I don't think anything will be wrong with you." The first thing that came to my mind was, okay, I could have leukemia. All the sores, I'm having bruises all over my body. And he said, "No, you look fine. I don't think you would have that." But after insisting and persisting, I did get lab work. Initially, he asked for my lab work to be routine, but I insisted, and I told him that I wasn't comfortable in going home until I knew what was wrong with me. So he did send me back to the lab, and they checked, and I was able to get my results within 30 minutes. I then realized the doctor then realized that something was very wrong with me. He called me into his office and he said, there is something wrong with you. So I asked what, and he said, your platelets are low. My platelets were at they were changing from hour to hour. Initially, the first lab work that I got, my platelets were at 8,000. Normal platelet count is 130. Within 2 hours, my platelet had dropped to 6, then to 4. I was admitted, or he sent me to the emergency room. While waiting, though, I was in close communication with my sister Estela, which is my caregiver, sister, friend, and we were in constant communication. So she was advising me. She has knowledge on labs, and she'll share what she does. But while working with her, she just kept telling me, sister, you need to continue asking. And so I was diagnosed with lupus a few hours after the lab work. My sister was with me when the doctor or emergency room doctor said that, that they couldn't do transfusions or any other treatments because my body was attacking itself. When I was there, my sister asked the doctor, does she have lupus? And so he asked her, how do you know? Are you a doctor? My sister said, no, but I've been researching the symptoms, and my sister has all the symptoms. At that moment, I didn't know what lupus was. I wasn't scared. I knew my platelets were low, and I was scared for my life because of the platelets, but I knew nothing about lupus. So soon after that, I was admitted to ICU. I was there for 7 days. And that's when my journey with lupus, started, I say, because that's when I started learning about lupus. And with my sister's help and her teaching me and bringing me the resources, though, after I was discharged from the hospital, I didn't know, again, much about lupus. There was not much information. Back in 2009, the only thing that you found on the internet or on Google, it was, there's no cure, you can die from it. So of course, I started feeling overwhelmed with the little information, yet no information that could tell me exactly what was going to happen with me. So I started loom knitting, and with my sister's help, with my family support, we decided, actually with Estela, she helped me so much, and just her being by my side, we started, and she started a support group within our family, then realized that there was so much information that needed to be shared with our community, especially with our Hispanic community. My mother doesn't speak English, so there was absolutely no information in Spanish. So we came about and we started supporting those living with lupus, their family members and caregivers. And I'll pass it on to Estela so that she can share a little bit about what we do.
Yes, thank you, sister. And I call my sister sister. That's just how connected we are. But if you guys look at her story and her journey, it's very similar to a lot of cases. A lot of people that don't know about lupus, that don't know what to look for, that don't know what symptoms they're having, that don't have that connection. I think earlier we were talking about, and we heard Tatiana speak on the symptoms and how it takes sometimes up to 2 to 6 years to get a diagnosis, and that it is, genetic and environmental. And one of the things that from the beginning we realized was this condition impacts my sister, it impacts her life, it impacts her children, our family, and the community as a whole. So we understood that we needed to not only raise awareness about what lupus was, but also ensure that the community as a whole knew what to look for and to hopefully minimize that time frame of getting a diagnosis, especially when a lot of symptoms are at times invisible, not always visible. So a lot of the visible symptoms that Juana was talking about was they were visible to her. You know, she had the sores in her mouth, she had the patches on her hair, the rash on her scalp, on her face, she had the butterfly rash. And obviously there were a couple of invisible ones as well, as such as the fatigue, the pains that only she could feel and tell us about. And so a couple of key things here to look at is there are invisible symptoms and there are many visible symptoms. And unfortunately, those invisible symptoms are the ones that are sometimes more dangerous. In her case, as she was talking about her story, she wasn't too afraid about lupus because she didn't know what to be scared about. What she did know was that something was attacking and causing her platelet count to go really low, which is what caused her to go into ICU for 7 days. Now, looking back, you don't get scared of things that you don't know. But unfortunately, not knowing can also cause a lot of irreversible damage that the lupus can cause in your body, especially lupus, the systemic lupus erythematosus, which is the most common and also known as SLE, which is the type that my sister has. Now, going back to the reason why we wanted to advocate and we wanted to support the community, and not just those living with lupus, but also the caregivers and family members, was because, like I said, it was going to impact not just Juana, it was going to impact her family as well, her children. The sun is something that, you know, we all say, let's go get some vitamin D. And even, you know, the providers tell you, you know, soak up that sun. Well, the sun may be good for a lot of people and it might provide a little bit of vitamin D, but for my sister, it could be really, really bad and cause her to flare up. So there are no two cases alike with lupus. So it's also very important to know what triggers those flares. And the flares really is when the symptoms are active in the lupus, when you are getting, you know, your labs may be abnormal, or maybe you're feeling a lot more of the symptoms. So it's also very important to know your body and know what triggers your body. And like I said, the sun may not impact everyone, but unfortunately with Juana, it does impact her. So knowing and understanding how the environment, how even the environment you're in, whether you're outside and the sun is shining, or whether you're indoors in an office and the lights are giving that UV rays, those can also be triggering. So knowing those little things here and there can be helpful. So again, raising awareness was huge for us. It was about not just about letting people know what symptoms to look for, so that way they can communicate with their doctors and get an early diagnosis, but also learning about how to advocate for yourself. Juana is alive today because she advocated for herself. She did not leave that doctor's office unless she was heard and she was able to get the treatments that she needed. She communicated with a provider, and that is really what saved her life. So, and you could go to the next slide for this one. So Looms for Lupus was really born from Juana's story, from Juana's journey. We knew that if she was going through that, and if she had someone like me that works in healthcare, that knows how to navigate care, knows how to ask the questions, and knows how to talk to these providers, not everyone feels as comfortable, as confident, because, you know, also our culture, we always think the provider knows and has all the answers, but sometimes the expert also lies in the individual. So we knew that we wanted to empower the individual to learn about the condition, to take action and work together with a provider. So Looms for Lupus is a nonprofit organization that we formed together, where we raise awareness and we provide support, not just for the individual, but for their loved ones and caregivers. We also support those that have overlapping conditions such as fibromyalgia. I myself don't have lupus, but I did go through a huge journey to get the diagnosis that I have. I do live with fibromyalgia, and about 20% of people that have lupus may have an overlap of fibromyalgia as well. And if you remember with Juana's story, she started loom knitting, which is where we came up with the name of Looms for Lupus. Is loom knitting when she was getting her infusions, it was just draining. It was impacting her not just physically, but also emotionally. And living with a chronic condition or debilitating condition can impact that. So we wanted to not just offer the resources, not just empower the individual, not just support the individual, but also provide modalities that they can utilize to prevent those flares and to support the mental health. So we also provide support with mental health. We raise awareness. We know that a lot of treatments are maybe sometimes very expensive. So we wanted also to be the voice for those that didn't want to share their voice, or they couldn't share their voice, or they didn't know how to share their voice. So we advocate for those that live with these conditions that sometimes have healthcare policies that impede them from getting the best treatments that they have. So you can go ahead and go to the next slide. So we do a little bit of advocacy, we do support, we raise awareness, but most importantly, you all are here today because one, you want to gain knowledge, you want to feel supported, and that's what we're about. We provide support groups, we provide symposiums, educational awareness, and every second Saturday of the month, we host a virtual support group at 9:30 a.m. every second Saturday of the month in English, every second Sunday of the month in Spanish. And we also host a virtual live Facebook and Twitter and YouTube live symposium in Spanish, where we just get to talk about not just lupus, but family and just everything that's going on throughout our lives, just to feel supported. Next slide.
Absolutely. And that's what we do. And when we have our support groups in person, well, we actually also do them when virtual. We have done several things virtually where we let the patients, caregivers, and loved ones know what we're going to be doing. So we do different arts and crafts, and we, like Estela said, there's different modalities that we do in our support groups just to cope, not only living with lupus, but with our mental health as well. So these are some pictures of things that we have done and we were doing when we meet in person. As you can see, we did a painting. Well, I'll start with the loom knitting. As we mentioned, when I was first diagnosed, I didn't know how to cope with knowing that I have this condition, that there's no cure and I can die from it. So I started loom knitting. I just wanted to be on my own by myself initially, just loom knitting, because I knew that putting one loop at a time, I was focused on doing that and not focused on what was going to happen to me the following day. So I started loom knitting. And as you can see on one of the pictures, I'm loom knitting with Estela's daughter, with my niece. And so that's what we started. And then we just moved on to doing other things. We do yoga, we do painting, we do arts and crafts, we do coloring. I mean, there's a lot of things that we incorporate in our support groups because we know that, that living with this condition can definitely affect our mental health. One of the paintings that we did, you can see there's a lot of us, a group, we painted a butterfly, which symbolizes lupus, and the flower symbolizes hope, and the green for mental health. So we always try to incorporate all modalities, and we incorporate not only the different things that are going to help us in our mental health, but also physically, and we get to move, we get to do different things, and just doing it together with the family, I think it helps a lot. So that's something that we are passionate about, and that's something that we do together as a support group. We get to share our stories, we get to share what helps me, what helps others, and what can help me, and what tips I can get from other lupus patients, caregivers, and loved ones. Next slide, please. And another thing that we also do is not only do we do the support groups, but we also attend health fairs. We do walks, and as you can see with the health fairs, I mean, we get to share this information not only to the lupus patients, but to many other people who may be living with pains and could possibly have lupus. That's something that we love to raise awareness about, is sharing the symptoms, talking about, that being a minority, being Hispanic, African American, Asian, that we can have this condition. And it's so important to not only look at the symptoms, but also to keep track of the symptoms, so that when you do get to go to your doctor, that you share this information with your doctor. As Tatiana and Estela have mentioned before, getting a diagnosis of lupus takes a long time. I mean, it can take from anywhere from 2 to 6 years. Somebody in the chat said it took them 7 years. Yes, it can take a long time, but if you come prepared to your doctor's appointments and you have a journal, that can actually help the doctor not only with the lab work and your symptoms, come up with a diagnosis, come up with a treatment plan that will help you. And next slide, please. Estela.
Yeah, so this is a great way to connecting with a community, whether they're children, the young adults, and also older, men, women, and just basically everyone in the community. It has been such a rewarding and just an amazing adventure for us, because we will meet people that tell us, my aunt died of lupus. I think she had that. And I don't know, I've been getting a lot of symptoms, but I don't know if I have it. So handing over a little card with like the most common symptoms and letting them know, go ahead and check off the list, all the symptoms that you've been feeling, and go take it to your doctor and make sure that they check your labs. Let them know about your medical history. Let them know that your aunt had lupus, and it will actually help them, get you to a sooner diagnosis. Whether you have lupus or not, it's always best to let your providers know about your history and your family history. So that's another thing that, we love is when we're connecting with a community, we find and we connect with people that, are even thinking that they possibly may have it, but they don't go to the doctor because they're not sure. And sometimes that card has taken them to go to the doctor, seek help, and get that early diagnosis. Because like we said, if you get an earlier diagnosis, it is a lot better than getting diagnosed later and where you will have irreversible damage. So we do provide a lot of advocacy, awareness, and support at local levels, state levels, and national levels. But the most important thing that I want to highlight, you can go to the next slide, is educating everyone, educating the community. And if I can leave you with anything, is communication is very, very important. Support. You are not alone in this journey. If you have not been diagnosed with lupus nephritis, you saw what Tatiana was showing earlier, that there's a chance, there's up to 40% chance that you can develop lupus nephritis, or those that live with systemic lupus erythematosus can develop it. And those newly diagnosed with lupus may already have kidney involvement. Now, with my sister, with Juana, she had a little bit of kidney involvement. So it's also very important to know, if you do have kidney involvement, learn about the different stages you're on. Empower yourself with the knowledge before you get diagnosed, when you get diagnosed with lupus, and continue to track those symptoms, because the symptoms to look out for is really whether your labs can be normal. You may have those symptoms that are happening internally that are visible or invisible to you, where you need to communicate with your doctor. So looking at those symptoms, such as the swelling, the high blood pressure, the foamy urine, the blood in the urine, the increased urination, those are things that not everyone may know about. you can know about it and might think that it's okay. Well, those are symptoms to look for when your lupus is attacking your kidneys, which is what's called lupus nephritis. So I'm so glad that there are so many resources out there. And Tatiana also mentioned a site, that link, and if you didn't get that, I can type it in the comments. The Us and Lupus .com is a website where they can provide you, or you can request a free symptom tracker. And what the symptom tracker does, it kind of guides you as to tracking your symptoms. And that way, if you start getting any symptoms that, you know, are new to you, you can come and discuss with your provider. You're part of your care team. You are part of your treatments and everything. So we want to empower you to take note, go to your doctor, and seek the treatments that you need. Also, it's very important to not only communicate with your providers, but also communicate with your loved ones, because if you forget to maybe mention it to your provider, your loved one can come with you to the doctor's visits. They can help you, or they can help you track these symptoms. And I know we've talked a lot already, but we have more resources on our website. You can scan the QR code that's on the screen now. You can visit our website. We have links to resources, and feel free to ask any questions. And I think I saw a couple of questions. I didn't read them. If you want to go ahead and go through the Q&A, that would be great.
I have an initial question. Thank you, Juana and Estela, for your wonderful presentation and wonderful information. I was wondering, knowing that this next coming month of May is actually lupus and fibromyalgia month, awareness month. I was wondering if you had any activities or any additional information that may be available in the coming days as we go on to this awareness campaign period for this wonderful and important information also about this disease that I think people need to learn more about.
Yes, Franco. So thank you for the question. We actually have Facebook Live symposiums where we host educational webinars, whether it's about lupus nephritis, lupus, communication. We host them in English and in Spanish throughout the whole year. But the month of May, we do have a wellness day. It is free to the public for loved ones and caregivers. We also support you when it comes to proclamations, requesting a proclamation in your city. That way it kind of indicates, and the legislators or the mayor can actually declare Lupus Awareness Month in your city. So we do help people get those proclamations in their city. That allows us to raise more awareness and touch more people that may not know what lupus is. We also have the support groups, but in the month of May, it is Mental Health Awareness Month, it is Lupus Awareness Month, and it is also Fibromyalgia Awareness Month. So we do host a lot of informational materials online and symposiums.
Thank you very much, ladies. Wonderful presentation, and I'll pass it on to my colleagues to
Thank you, Franco.
Thank you.
Thank you, ladies. We do have a couple questions. The first one just asked if you sell any of your art projects.
No, we don't. We have not sold any of the art projects. So what we do is we'll host the painting sessions. Everyone can it's kind of like the paint and sip. And people can just come and relieve their stress, because art therapy is actually a great form of therapy. Mindfulness, you get to focus on one thing. So no, we don't, but we will have on the wellness event that's happening on May 20th, we are going to have a painting session. So you can actually join for free, and we can help you get the materials so you can create your own masterpiece at home.
Great, thank you. The next question asks if someone with fibromyalgia can develop lupus. That might
so
be.
I'll give you an answer. So I know with a lot of people that live with lupus, there's about a 20% chance that they can also develop fibromyalgia. I don't know if it's the other way. I'm not a doctor, but I can tell you that for me, when I was diagnosed with fibromyalgia in 2018, and there's not a lot of research still for fibromyalgia. So we are also advocating for more research, so we can find out more about the cruel mysteries that fibromyalgia comes along with. But Juana does live with fibromyalgia as well.
I do. I do live with a couple of autoimmune conditions and fibromyalgia.
Thank you, ladies. If there are any more questions before we wrap up the program, please type them in the chat box now. And anything that is not covered during the program, we will be sending a follow-up email that will cover resources and any answers to unanswered questions. So stay tuned for that coming after the program. Okay, I do not see any more questions. So I will just go ahead and share some wrap-up information. Thank you, ladies. Thank you for sharing your story, Juana.
Thank you.
All the resources that you guys have created for all of these people in need.
Yeah, I just want to share with everyone that, you know, it is so important to advocate for yourself. We love doctors. We know that they are the experts, but we are the experts on our own body. So please advocate for yourself if you have to, with all the respect to the doctors, but we are the CEOs of our bodies, and we know when something is not right. We need to talk and make sure that the doctors understand.
Thank you. Yes, that's absolutely true. Okay. So we want to take a minute to let you know that NKF has resources and support available to you outside of these webinars, and hope that you'll reach out to us in any of these ways. This info will also be provided in the follow-up email that will come after. And speaking of getting involved, the Kidney Walk is a great way to experience and support each other in the kidney community. We have our local kidney walks returning to in-person. We have our upcoming ones in the fall. So in San Francisco, California, that one will take place on September 18th. And then on October 30th, there will be one in Southern California at Long Beach's Marina Green Park. So if you live in a different area, you can check kidneywalk.org for a walk near you. In fact, we just did ours in Arizona last weekend on Sunday. So that was a great event, and they are just a wonderful way to engage with other individuals who are experiencing the same kind of issues that you might be, and get resources unlocked to you. If you love to read, another opportunity is for the author's luncheon. So check that out on the website as well. Now, for those of you tuning in from Arizona, I just wanted to share just a tiny bit about our organization. We are the National Kidney Foundation of Arizona, which is an affiliate of National. Our mission is commitment to the prevention of kidney disease through awareness, education, and research, and to improve the quality of life for Arizonans with kidney disease. So our values shape our work. We are guided by these shared core values that we live by as a foundation and as individuals: quality patient services, premier information source on organ donation and kidney health, advocacy, compassion, volunteerism, diversity, and organization sustainability. Here are some of the programs that we offer to our patients that we serve. We have patient assistance, and this includes dental assistance, transplant and general medication assistance, dialysis and transplant appointment transportation, utility assistance, rent assistance, and nutritional supplements. We also provide outreach for patients in the community, such as patient education and advocacy programs. And then a Path to Wellness free health screening for the prevention of chronic disease contributing to diabetes, kidney disease, and cardiorenal syndrome. We also provide professional education programs. We do an annual Southwest Nephrology Conference. It's something in our region, and it's always a great program. Takes place in March. We do grand rounds for healthcare professionals and virtual grand rounds, and then symposia. So those are items that you can check out on our website. If you want to find any of those, you just go to our homepage, azkidney.org. From that homepage, you select events, and then you can find any of the healthcare professional under grand rounds, and then the patient assistant programs would be under patient resources. We want to thank you so much for attending this program today. Please reach out to us with any questions. Look for that follow-up email that has the resources and any information that was provided today so that you can access that afterwards. And we ask that you please take the program evaluation that will be available on the exit page once you exit this webinar. Thank you so much to Tatiana for providing such an awesome presentation, and for Juana and Estela for sharing your story. And we also thank the partnership with GSK for providing this webinar.